Good morning. It's 11 a.m., so let's get started. Welcome to the Dole VA Medical Center's Town Hall. I'm Public Affairs Jeff Herndon, and I will be your moderator for today. We're going to provide updates today on VA programs and services, followed by fielding your questions. But let's review some housekeeping notes first. And next two slides, please, Tamara. Thank you. So please be aware that today's session is being recorded so others may view it at their convenience. If you have questions at any point during the town hall, I encourage you to submit it via the chat window at your earliest opportunity. Also, at the end of our presentation, guests can unmute their mics to ask questions. When asking questions or making comments, please refrain from sharing personal information, whether it be your personal information or that of a comrade or friend. We do want you to be aware the link to this town hall has been shared publicly, meaning anyone could be logged in and watching us. So, let's get going. Next slide, please. Medical Center Director Michael Payne is going to share information with you this morning on some of our recent accomplishments, a new VA initiative known as ACE, and our progress on achieving functional zero. Sir?
Okay, good morning, everyone, and thank you, Mr. Herndon. Let's go to the next slide, please. Okay, so thank you for joining us today. It's our pleasure to host these quarterly town halls in an effort to keep our veterans, their families, caregivers, and survivors, and our community partners well informed about the wide array of changes going on within the Department of Veteran Affairs and locally here at our Dole VA. So on the slide in front of you, you see for the third consecutive year, the Dole VA has earned a 5-star rating from the Centers for Medicare and Medicaid Services in their annual overall hospital quality star ratings. The Dole VA is one of only 18 VA facilities to earn 5 stars over these first 3 years that the CMS has been rating VA facilities. Nationally, the VA hospitals continue to outperform non-VA hospitals on both CMS overall star ratings and their quarterly patient satisfaction surveys. 77% of VA hospitals included received either a 4 or a 5-star quality rating, and that is up from 58% last year. The Joint Commission, commonly referred to in the medical community as TJC, originated in 1951 as the Joint Commission on Accreditation of Hospitals. Their mission is to enable and affirm the highest standards of healthcare quality and patient safety for all. They are trusted by over 24,000 organizations globally to uphold standards that improve patient outcomes. Joint Commission accomplishes this through triennial surveys of healthcare facilities, and that includes VA medical centers like ours. The Joint Commission conducted an unannounced survey of the Dole VA, including our community clinics around the state just a few weeks ago. We have received their final report, and I'm proud to say that we have been reaccredited. Both internally and in public, I routinely talk about Dole VA's methods to continuously review our processes and policies to define better ways of doing things and then implementing those changes. If we are not examining ourselves and making changes, then we are not improving. The Joint Commission noted some items that we could work on, and we have already begun to deep dive into those areas to find the root cause of each one of those and implement a plan to correct them. Next slide, please. Executive Order 14296 was signed on May 9th, 2025, and provides a tremendous opportunity to provide our veterans with real and meaningful choices in their healthcare journey. This executive order aims to improve access to timely, consistent, and compassionate care for our veterans. It mandates a focus on streamlining processes and eliminating waste. It enhances scheduling options, clinic hours, and telehealth services. It demands strong leadership accountability at all VA medical facilities, and it aims to solidify VA's role as a leader in veteran healthcare and ensure the best outcomes for all that have served. The VHA is just beginning to implement some of those changes coming through our Access, Choice, and Excellence initiative, and we will continue to provide you with more information through our various communication channels as it becomes available. Next slide, please. A continuing priority for VA is improving outreach to our most vulnerable veterans through our homeless program. We've been working hard toward Functional Zero, which is essentially building a system where every veteran who is experiencing homelessness is known to us by name, and we have the right resources and partnerships in place to get those veterans housed quickly. It doesn't mean that homelessness never happens, but it means when it does, it doesn't last long and it doesn't reoccur. An important part of getting to Functional Zero is having quality data, and this means our by name list with real-time, accurate, and useful information. It helps us track those that are in need. It helps us find where they are in the process of getting housed and what we need to do to make that happen. From January 2024 to date, our community has seen about a 12% reduction in veteran homelessness. This is in addition to the 12% reduction we accomplished the year before. We thank our community partners who support the effort to reach Functional Zero homelessness among veterans. In particular, the City of Wichita and the United Way of the Plains are critical partners on the front line of that battle. Next slide, please. When it comes to combating veteran homelessness, we are never closed. A veteran who is homeless or in imminent danger of being homeless can walk into our emergency room any time of the day or night and receive assistance. They can call the 24-hour homeless hotline and get connected to local resources. And that's all I have for you today. Thank you for joining us. We have some great topics on this quarter's agenda, so I'll pass it back to Mr. Herndon. Thank you.
Thank you so much, Mr. Payne. We really appreciate you taking the time to join us and share all of that information with our audience. And just to highlight, since he just closed on giving you an update on our homeless program, we do have our homeless stand down this Friday, October 10th at Hyde Park in Wichita. That takes place 10 a.m. to 3 p.m. As Mr. Payne stated, the City of Wichita and United Way of the Plains are very important partners in executing that program, but we do have more than 50 service providers that will be joining us out there as well. And so if you know someone who is homeless, if you're homeless yourself, or you know someone who is in imminent danger of being homeless, please have them come down to Hyde Park Friday morning, 10 a.m. to 3 p.m. Next slide, please. So VA is committed to a culture where everyone is treated with civility, compassion, and respect. Everyone should feel welcome and safe when doing business with VA. To accomplish that, everyone needs to understand what is and is not acceptable behavior. Our harassment prevention coordinator, Lydia Newrath, will share information with you on our program and the reporting processes. Lydia?
Thank you, Jeff, and thank you all for joining us today. As the Harassment Prevention Coordinator, it's my role to ensure that we're providing a safe environment for our veterans we serve and for our staff. That means an environment free from harassment, and sexual assault. Studies have routinely shown that upwards of 50% of healthcare workers experience sexual harassment, a rate significantly higher than that of other industries. Our VA is committed to a culture where everyone is treated with courtesy, compassion, and respect. I've provided definitions on this slide of harassment, and sexual assault. In the interest of time, I will not review all of the examples included under each definition. But harassment is defined as unwelcome and improper behavior based on the quality of an individual. Examples are listed there in the bullets. Sexual harassment is unwelcome verbal or physical conduct of a sexual nature. This can include, but are not limited to, those in the list below. Sexual assault is defined as unwanted contact or attempted contact without consent, which can also include unwelcome hugging or touching of an individual. When a patient is suspected of committing a violation of these, the Dole VA has an interdisciplinary team who will review all reported incidents of actions described and determine if appropriate corrective action is necessary. We seek to provide our staff with safety and respect in the care of our veterans. Next slide, please. Should you as a patient experience harassment or assault, please reach out to any of these offices listed here, the VA Police, the Veteran Experience Office, or myself. You may also report it to the hotlines listed here. I'm located here at the main Wichita campus, but cover all of our CPOC locations as well. I want to ensure both of our patients and our staff are treated with respect and provided with a safe working environment. And in that, I ask for your help. Thank you.
Thank you, Lydia. Appreciate that information. You know, significant portions of this facility were built in the early 1930s. So we stay pretty busy with construction projects to ensure we are able to provide 21st century healthcare and services to the veterans we serve. Projects Chief Nick Howard will tell us where we're at on many of those projects. Nick?
Thank you, Jeff. Next slide, please. So what we're looking at is just a general map of our campus, and I wanted to highlight what's all going on across the station here. Moving from east to west, the Community Living Center, Building 60, is the large project that's impeding the traffic over there on that side of campus. That project will add a considerable amount of square footage to our Community Living Center and making the rooms there private. The endoscopy suite, Building 34, in the center of the page is a three-floor addition to Building 34. The top floor is our endoscopy suite. The next floor down would be our new IT space, and then the ground floor would be our biomedical team. Moving to the southwest of that space, you see the med surge beds on the third floor of Building 1. That is what we also refer to as 3 East, or our medical surgical inpatient beds. We are doing some repairs to our air handling unit in that space, and that is awarded and pending construction schedule, and will hopefully close out in late spring of next year. We've made some arrangements to include some temporary air handling units to expedite that time as well. And then our Building 26 project is well underway. The first phase will be closing out at the end of this year in December. And we'll be opening up the canteen and retail space in January this next year. And then the entire project will complete in the summer of 2026. And then, of course, on the east side of our campus is the large City of Wichita Drainage Canal project. That is not something that we're managing, but obviously it's impacted our station and parking on that west side of campus. Unfortunately, because of the amount of rain we've had this season, it has experienced some delays, and I believe it will be finishing in the early spring of this next year. Next slide, please. Much of this is what I've already talked about already with our Building 26, Building 34, and Building 1. The Building 3 pharmacy project that we've been very excited about because of its not only its connections to the pharmacy, but also connections to updating the parking in front of the building. The contractor bids were over budget, and so we've had to kind of go back to the drawing board to see how we can address those needs through other projects. So there'll be more information to come with that one in the future. Next slide, please. And in these pictures, what you're looking at is the rebar and the concrete forms that have been set, and concrete was actually poured in this area late last week. And so this would be the foundations of the new expansion for Building 60. That building will be coming out of the ground very soon, so we're very excited about that. Next slide, please. And then our renovations around campus. Our Building 13 boiler plant will be finishing up early next year. Our chilled water plant and emergency power plant are in design currently, with them finishing in the spring of next year. Our building 4, much anticipated, completion will be in December of this year, so very soon for that one to be finished. And then our gamma camera, fluoroscopy, cath lab, and digital radiology are all projects connected with our biomed team and bringing new equipment to the facility to provide updated care for those types of disciplines. Gamma camera and fluoroscopy are under construction, and the other 2 are in design. The last 2 on the list is our fire alarm infrastructure, which is in design. We'll be replacing the system station-wide. And then the last one is the restroom renovations in Building 61 and the updates to the women's lactation space in Building 34. Next slide. And then new projects planned for this coming year, starting this month, would be our design for our new PET CT equipment and some the update to the wayfinding, or what we call wayfinding, would be new signage around the station to help veterans find their way through our campus. The entire wayfinding or signage system at the campus will be updated through this project. And then the next one is the nurse call and public address systems. Those will both be completely renovated. And then we will be just starting design to add another floor to our Building 61 for new space for our eye clinic and audiology. And then we'll be doing some roof repairs for Building 1 and 4. And then pending our design completion that I spoke to earlier about the renovations, restrooms, and lactation space, that will go into construction along with the cath lab that's in design. Will also go into construction this year. If you have any questions, don't hesitate to reach out. Thank you.
Look, Nick and the entire engineer team stay very busy, and so I really want to say thank you for taking the time to join us and give us that update today, Nick. And also, you know, that beautiful picture of rebar makes me want to go home and start some new projects. So thanks for giving me a little motivation there. Hey, you know, these days we see a lot of animals in various facilities that we visit. In our healthcare environment, what is acceptable and what is not. Police Chief Chad Allen is going to set the rules straight for us right here, right now. Chief, it's all yours.
All right, good morning. So on this policy, it'd be really nice if they changed the title of the policy to service dog instead of service animals, and you'll see why here shortly. All right, this is VHA Directive 1188-1, and it's in reference to what animals are considered service animals on VA property. Go ahead and go to the next slide, please. So service animal. As you can see, we have pictures of dogs here. That's because the only authorized service animals on VA are dogs. So service animal means any dog that is individually trained to do work or perform tasks for the benefit of an individual with a disability, including physical, sensory, psychiatric, intellectual, or mental disability. Other species of animals, whether wild or domestic, trained or untrained, are not service animals for purposes of this definition. You would be surprised the kind of animals people try to define as service animals. Snakes, chickens, miniature horses, etc., are not service animals per this definition. All right, next slide, please. Animal access criteria. So again, a service animal is a dog. It is trained to do work or perform tasks for the benefit of an individual that has a disability. In that situation, they must be granted access to VHA property when accompanying that individual that has the disability. Again, if the animal is not a dog, it is not a service animal under this definition and for VHA consideration, and must be denied access to VHA property unless an exception applies under paragraph 5B, section 4 of this directive. And we'll get to that shortly. A service animal in training is not a service animal and must be denied access to VHA property, again, unless there's an exception that applies under the same exception rule. Next slide, please. How do we determine whether a dog is a service animal? Staff cannot ask about the individual's disability. We cannot require medical documentation. And we cannot and will not require special ID cards or training documentations for the dog. And we can't ask your dog to demonstrate or do tricks or anything like that either. So what can we ask? Well, it's obvious that the dog is a service animal. There's only two questions that we can ask. Is your dog a service animal required because of a disability? And what work or tasks has your dog been trained to perform? Those are the only two questions that we're allowed to ask. So denied access. So if we deny access to an animal because it is not a service animal, the individual that brings the animal to the property still must be given an opportunity to obtain care, VA services, but without having the animal on VHA property. So we'll still work with the individual to make sure they receive their care. Responsibility for the service animal while on VHA property. So this is important. You bring a service animal in, at no time will staff or anyone else that works for the VA, volunteers, CWTs, or anyone else assume responsibility for or care for or supervise the service animal. It is not the staff member service animal while the service animal is on VHA property. And there are certain areas that the service animal may and may not have access to. And there are some legitimate reasons for this. So they can accompany the handler or an alternate handler. You can bring an alternate handler with you to access VHA property. The general public areas are acceptable, and they're subject to the same rules. General public area where the presence of the service animal would not compromise patient care, patient safety, or infection prevention and control standards. Service animal is not permitted to access some other areas on VHA property. Those would be areas such as the operating room or surgical suites, places where invasive procedures are being performed, or acute inpatient hospital settings. Unless specifically granted permission by the medical provider. Areas of VHA property the service animal may not access continued. Decontamination. Obviously, we don't want them where sterile processing is being conducted. Sterile storage areas. Consistent with access permitted for general public, any areas where chemicals are stored or mixed that wouldn't be good for the service animal or for the patients receiving care. And food preparation areas. That does not include public food service areas. They are allowed into the canteen, just not where the food's actually being prepared. Areas where personal protective clothing must be worn or barrier protective measures are taken. Removal of service animals from VHA property. Reasons that service animal must be removed from the property are as follows. The service animal is not under the control of the handler or the alternate handler. Some examples of this would be a dog that's running loose. They're not being accompanied by the handler or alternate handler. Excessive barking that's not brought under immediate control. If you have a dog that's jumping on individuals or furniture, a properly trained service dog will not do that. The service animal is not housebroken, or the service animal poses a health risk to patients, visitors, staff, or other service animals. Obviously, flea infections, ticks, stuff like that. It has to be well maintained. And again, if it's removed from the property, the handler must be given an opportunity to obtain service without the service animal on VHA property. Use of service animals by VHA staff. All the criteria, same criteria related to service animals, applies to those who work here. He or she must contact local reasonable accommodations and have an accommodation made. All the criteria must be met, and work with human resources to request the RA for the service animal. Non-service animals. Again, the only service animal is a dog. Granting or denying access, it means only service animals are accompanied by individuals with disability. They're specifically trained to assist with the individual, have a right to access on VHA property. So don't bring your horses, your donkeys, and cats. VA medical facility director's discretion. So again, we talked about paragraph 5B4 of the directive. Non-service animals may be granted access by the medical center's discretion under certain circumstances. Next slide, please. Only the following non-service animals may be present on VHA property. Animals for law enforcement purpose. Animals under control of VHA research and development. Animals for assisted therapy. Animals for assisted activity, and residential animals. And again, those fall under paragraph 5B4. That's not for veterans, just to bring them in that do not apply under those exceptions. And that's all I have, unless anyone has any questions.
Not seeing any questions in the chat right now, Chief. Stick around for the end of the presentation. Somebody may want to come off of mute and ask you a question on that topic, because it's an important one, and
It is.
it can be a little controversial at times as well. I noticed you sounded a little under the weather, so you might want to stick around for this topic as well. Vaccines have been a hot topic the past few years. And just as recently as Monday, new guidance came out from the CDC. Pam Goebel-Roberts, our program manager for health promotion and disease prevention, is here to share the latest and greatest with you. Pam?
So first, I'm going to start vaccine.
You're really difficult to hear, Pam.
I am. Okay. Well, let's see.
That's a little better right there.
Is that a little bit better? Okay.
Oh,
well,
yes, absolutely.
I'll hold it just right in front of my mouth then. So,
Thank you.
yeah, no problem. So, but yeah, I'm going to talk to you a little bit about the flu vaccine first, and then we'll get into the RSV and COVID vaccines, because really fall has become respiratory vaccine season, with those three being promoted throughout healthcare. So, first is the flu vaccine, and we do offer the flu vaccine here at the VA. And it protects this year against three influenza variants that they think are going to be causing the most infections this season. That includes one type B variant and two type A influenza variants. And the high dose or adjuvanted flu vaccine is recommended for anyone over 65. Those just have a little bit of an extra ingredient or extra parts of the vaccine that give your immune system a little bit of a boost if you're over 65. And here at the Robert J. Dole VA, we do offer one of those products for those over 65. So that is definitely an option if you're over 65 and want that. This year, all flu vaccine formulations are required to be thimerosal free, and they are all individual dose. So, and that, we have those here. We are having walk-in clinics here at the main facility and then at a couple of the CBOCs. At our main facility, we're having it on the first floor of Building 3. And if you're familiar with the area, that is where they have the popcorn on Tuesday mornings. It's in that lobby waiting room in Building 3. And it is being held Monday through Friday from 8 a.m. until 3 p.m. From now until November the 7th. And that is walk in. You can just come in and get that vaccine without having any type of an appointment. The Hutchinson CBOC is also going to be offering walk-in flu vaccines on Wednesdays from 8:30 to 11:30 until November the 5th. And then the Parsons CBOC is also doing walk-in flu vaccines from 1:30 to 3:30 on Tuesday, Wednesdays, and Thursdays until November the 6th. Now, for the other CBOCs, they do offer a vaccine. So I would just call first just to make sure that they have those in stock. And then, you can go into those clinics as well. We are also offering flu vaccines at appointments in primary care, at the CBOCs and specialty clinics and in mental health. So if you have an appointment coming up, you can get your vaccine in those areas too at your appointment. We do have a contract with community pharmacies through the CVS Caremark network. And as a veteran, you can get your vaccine at no cost at those pharmacies. And these do include some of the larger pharmacies like CVS, Dillon's, Walmart, and Sam's. And then here in Wichita, Dan Durand and Hart Pharmacy are in network. And many local pharmacies are also in network. So if you go to a smaller pharmacy, you might just call first to make sure that they're part of that Caremark network. One of the notable large pharmacies that's not in network is Walgreens. So they are not considered in network, and you won't be able to get a flu vaccine there at no cost. So I'm ready for the next slide. And then the next vaccine I'm going to talk about is the RSV vaccine. These recommendations really haven't changed much this year. The main one is for the age recommendation for people with risk factors changed. It was 60 to 74 with risk factors. It was recommended that they get a vaccine, and they reduced that age to age 50 and up with risk factors. So if you fall within that 50 to 60 age range, and you have risk factors like asthma or COPD that would make you more likely to have, a severe response if you were to get an RSV infection, it's recommended that you do get a dose of the RSV vaccine. And then anyone above 75 years is recommended to get that as well. And pregnant women from 32 to 36 weeks with the Abrysvo product. For RSV, it's just important to remember it's a single lifetime dose. So if you had one last year or the year before, you don't need to get a booster on that. And if you do think you qualify for that, you're part of that new age range, you can contact your primary care provider to get that and get scheduled for that. And then lastly is the COVID-19 vaccine. This is the one that we've had some changes, just this week on some of the recommendations. The CDC's advisory committee had met in September and recommended the vaccination for individuals who are 65 and older and those from 6 months to 64 years with risk factors after a conversation with the healthcare provider. And just on Monday, the CDC's director approved those recommendations for the CDC. So we'll probably be seeing a little bit more of those, out and about, and maybe some news and advertising for the COVID-19 25-26 edition on that. So that was just approved this week. And the FDA did approve those for 65 and up and those with at least one risk factor. So I know that there are community pharmacies within that CVS Caremark network that have the COVID-19 vaccine. And here at the Dole VA, that's something that we're working on, availability. We did receive a small shipment in, but it's not widely available here yet. That's something that our pharmacy and our teams are working on. So you can always contact your primary care team to see if that's something that we have. Or if it's easier for you to get at one of the community pharmacies, it's like the flu vaccine, that's available through the Caremark network, through the pharmacies that I listed before. And that's really all I have. If anybody has any questions, just let me know.
Yeah, Pamela, we're a
Oh,
little
okay.
ahead of schedule, so let's take this one right now
Okay.
that was submitted
Okay.
in the chat. Corwin Chamberlain asked, are these vaccines available to all veterans or just those who are qualified for VA healthcare?
Now, to get the vaccines here at the Robert J. Dole VA, it is just those veterans who have care through our facility, and so those are available if you've signed up and been enrolled in VA healthcare.
Okay,
So yeah.
to your knowledge, the pharmacies downtown, do they offer them free or at a discounted rate to non-enrolled veterans?
I don't believe so because you have to go through that Caremark network, and that's veterans who are enrolled in care. That's my
Okay,
understanding. So
okay,
yeah,
all right. Now,
yeah.
I have one more question for you.
Sure.
At least once a year, I have somebody tell me, well, I got a flu shot back in 1997 and I got the flu. Oh, the worst I've ever had it. And so I don't get that flu shot anymore. Can flu shots actually cause the flu?
No, it's an inactivated virus. So there's one of two things that happen when people have issues right after they've gotten a flu shot. One is it could be your immune response. So sometimes that's where you get the achiness. You just feel kind of bad for a day or two. Maybe your arm is sore, and just generally, since your immune system has gotten exposed to that inactive virus, you do have a little bit of an immune response, and that can be, misconstrued for the flu. The other thing is does take a couple of weeks for it to be effective. So if you get your flu shot and then a couple days later, you go to the store and you get exposed to the flu virus, you might get sick just because your body hasn't had time for that vaccine to be effective. So. Yep.
Great. Thank
Yep.
you so much for that
Sure,
additional
sure.
information.
Yeah, yeah.
Corwin, I'll just say, if you're not enrolled for VA healthcare, there's about 16,000 of them right here in Sedgwick County alone. We encourage you to apply. The PACT Act that was signed into law in 2022 really opened up the door for a lot of veterans to qualify for healthcare. And if you are enrolled, but you know veterans who are not, encourage them to apply as well. We all, as veterans, earned and deserve the benefits that are offered to us because we did earn them. So I got one more question from Bob Emmert. When going to the community pharmacy, is any kind of referral needed?
For the flu and the COVID vaccines only, you don't need a referral for those if it's in that CVS network. If you want to get any other vaccines at a community pharmacy, like you wanted to get the RSV vaccine, for instance, at a community pharmacy, you would need a referral for that.
So if Bob goes to CVS to get his flu shot, does he need to take his Veterans Health Identification Card with him? How do they determine that he
He
is
should
enrolled?
take that. That way they can know that he's a veteran and pull it into their system there.
Great, thanks. Okay, just to make sure that we finish on time, I'm going to move on from flu shots. Appreciate that information, Pamela. It looks like we are going to finish up early, so we'll have plenty of opportunity for questions at the end if anybody has any. Again, we encourage you to submit those in the chat because we can frequently answer them before we even get to the end. But qualifying for dental services and what dental services are available at each VA facility is a complex situation, and we frequently field questions about it. So we've asked our dental service chief, Dr. Scott Melton, to join us today and kind of iron out some of the details for us. So, Dr. Melton, the floor is yours.
Good morning, Mr. Herndon. Well said, and thank you. Can you go back to the previous slide, please? I just want to make sure everybody sees our dental clinic phone number and the extension. That is an important component to obtaining an appointment at the VA dental clinic. So please take a moment and write that down. It may help you obtain care in the future. Next slide. All right, our dental clinic is a little bit of a smaller clinic by nature. We have 2 current dentists that are staff dentists. That includes myself as well. We do have onboarding a new dentist currently. We're hoping to have them by the end of the year. We've got 2 hygienists and an additional hygiene supervisor, 5 assistants, and some MSAs that help us out with our scheduling. They're our front line. They're the people that say hello when you come in and help get you guided for your care. We provide services that are diagnostic in nature, including like examinations that can be comprehensive, or they can be shorter exams like your 6-month ones, or even limited ones for dental emergencies. We do regular x-rays. We take intraoral photos. We've got cone beam or 3-dimensional capabilities here to help with pathology and including infections, jaw fractures, things of the sort. We do a lot of preventative services in the dental department, including dental cleanings, fluoride treatments, and patient education. Patient education is about why tooth decay happens, how to maintain a good, healthy mouth, like oral hygiene instruction, smoking cessation, alcohol prevention, and I shouldn't say alcohol prevention, but how alcohol and drug abuse can affect negatively your oral health. And so we talk a lot about that and guide people in the right direction to make sure that they have access to the services that are available to help them out with that. Periodontal services, that's for the health of your gums. So some people that have periodontal disease will need scale and root plane, which is a deeper cleaning to help manage the disease process. That disease process, that inflammation destroys tissue and bone that hold your teeth in place. And so since your teeth and the bones and the tissue are kind of the foundation for the rest of the care we do, it's very important that periodontal services are provided thoroughly and timely. And we've got a great staff of hygienists to help us out with that. Restorative services, we do white fillings. We do a limited amount of silver fillings as we continue to progress in time with dentistry, with technology. Our composite or white fillings have advanced to the point where we place them in most of the teeth that need to decay restore with fillings. There are some areas where it's in the back of the mouth below the gum line where we are having a hard time isolating moisture control or whatnot. So we still use silver fillings on a limited basis. When a tooth structure cannot be restored with a regular filling, we do some crowns. Sometimes we replace teeth with fixed bridges, or sometimes a partial denture, something that comes in and out of your mouth. And then for cases where people are fully edentulous, we do complete dentures. Implants are something that is also provided through the Department of Dentistry. Through community care, we are not doing any actual implant placement here at this VA, but we partner with community care providers that place those implants and then work to restore them with partials, overdentures, things of the sort to help our veterans retain teeth and give good oral function. We have got an oral surgeon on staff that's part-time. He mainly provides tooth extractions and biopsies of suspicious lesions that could be cancer. We do refer out for surgical services that will need sedation. So next slide. How to get an appointment or communicate with the dental department for your dental needs. So here's the phone number again to our dental clinic. A simple phone call will be screened by one of our MSAs. They can let you know our availability, and if that fits your time scale, then they'll get you scheduled. If it doesn't, because wait time or drive time eligibility, which we'll discuss in a minute, then they can help guide your care that way. They typically will send a request back to me, and we try to get you a community care consult scheduled to make sure you get timely care. A lot of veterans, when they're in the VA, will just stop by the dental clinic. They're here for other services, but they know they need to go to the dentist or they need to change an appointment they already have. So just stopping in anytime is a good option. We are open 8 to 4:30 every day, except for some of our holidays, of course. But we have meetings in the morning for patient safety reasons from 8 to 8:30. So we typically open the door in our dental department at 8:30 for walk-ins. Another way you can ask if you're having a hard time getting in or can't stop in the VA or don't have access to a phone immediately, but you're with a regular care provider like your PAC team, you can ask them to place a dental consult for you. When you're reviewing your regular care, you can talk to them about a toothache, or if you're in the emergency department, they can place a dental consult, which then we screen those and then schedule the appointment for care in the dental clinic or place a community care consult depending on the appropriateness of the care needing to be done. Another way you can directly contact with your providers or request an appointment is through My Healthy Vet. It's a secure email system. You can, like my name, Dr. Melton, if you look it up on My Healthy Vet, if you have access to it, my name will pop up and you can field a question directly to me and I can help you out. If it's like I'm having a hard time getting an appointment, I can make sure that we go the right direction with that, get up with the MSAs know to get a hold of you to get something scheduled. If you're having problems with like something with community care with a provider or getting a request for service completed, that's a good way to reach out directly as well. Next slide, please. Eligibility, as Mr. Herndon said, complex. The most important thing is to start with eligibility and enrollment. I've given you their phone number there on the screen and the extension to their department. So gaining that first step of eligibility is important, making sure that you are eligible for dental happens kind of through eligibility and enrollment. We don't determine your eligibility per se, but once your eligibility is determined, then we can help review that eligibility. We can look at it and determine what type of classification you have and what type of benefits you're actually eligible for care through our Department of Dentistry or through community care, or either one. There's a lot of different classifications that come into play, and each veteran is individual and specific for what they're eligible to get. A couple of the classifications, somebody may not be fully eligible for care, but because they're being treated for something else, if their dental concerns are impacting that care, sometimes you'll have some limited eligibility, and that's generally reviewed by me, the dental chief. And then in those specific cases, we'll work directly with the PAC team or the other person that's providing the care for that, where the dental is impacting that care, to make sure that we're providing the care that needs to be done so you can safely get the care you need from that provider. Next slide, please. Eligibility for community care. As we mentioned, our dental clinic is not very large, so that makes us very busy. We have a lot of veterans, 32 teeth each. You might imagine we've got a lot of care or a lot of teeth to take care of. So with being busy and being a smaller clinic, sometimes our wait times grow a little bit longer than we want them to be. We want them to be short, and we want to capture all of the care of our veterans, but sometimes we have to rely on community care to help our veterans get the care they need. If you're asking for an appointment and our wait time is over 28 days, then you may be eligible for community care. And that's where we can place a request for service out to community or a consult out to a community care provider for you to get your care there in a more timely situation in some cases. If a veteran is eligible for comprehensive dental, we don't provide a covered service like sedation for, like a wisdom tooth extraction or something like that. Since we don't provide sedation at the VA, then you become eligible for community care that way, even if you're not wait time eligible. It's just you're eligible for the care, but we don't provide it. And then there's also something called drive time eligibility. And if the calculator kind of shows that you're 60 minutes away or longer, you become drive time eligible, by which then you can access community care services to help you out. Next slide. Exciting news for the dental department. As earlier mentioned, the construction projects are well underway here at the Dole VA. Dental is inclusive in that. So part of the Building 26 infill project is the new dental clinic. We're slated to be done June-ish 2026. This is going to provide us some additional capacity to provide the care for our veterans. We'll have 2 more dental chairs. It'll be up to date. There'll be new equipment. Very exciting stuff. I'm very excited for our facility as a whole, and also for our dental department and the veterans that are going to come in and access that care. Technology does continue to change the way dentistry is being done. We talked about silver fillings going to white fillings. We talked about old type of crowns, the porcelain fused to metal crowns going to, and gold crowns going to the white, full porcelain crowns or zirconia crowns. We're also looking at getting mills down the road, and like where we can possibly do same day crowns. That we're looking into that as that possibly being something for our new dental clinic. We have integrated the use of cone beam computed tomography, also known as 3D imaging. We mentioned that earlier. That helps us with a 3-dimensional version of your mouth to help us determine whether you've got good quantity and quality of bone for like implant placement. It helps us with the pathology. It helps us determine like fractures in teeth, problems with sinuses. Not that we deal with sinuses, but sometimes when we place implants, if you don't have enough bone, we need to evaluate the sinuses to determine if you have enough space. So that has been very good technology integrated into our dental clinic in the last 2 years. Next slide. And back to our staff. Our National Dental Hygiene Month is this month. Again, we mentioned we've got 3 hygienists, all which provide excellent service to our veterans. They truly are top-notch hygienists. You come to visit them, you'll find that out on your own. And I'm very, very happy to have them here. They're a very integral part of our team and very integral part of your oral health as a veteran. I'm up for questions if anybody has any.
Thanks so much, Dr. Melton. Really appreciate you providing that insight to the veterans that we serve here at the Dole VA. No questions in the chat right now. We will be opening up for questions over the microphone here in a couple of minutes, so stand by. We are a couple of minutes ahead of schedule, and Mr. Payne mentioned up front that we are constantly evaluating what we're doing and how we're doing it to make sure that we are constantly improving and providing the veterans we serve the best possible care that positively impacts their quality of life, as well as a customer service experience that is beyond reproach. And a part of that is getting feedback from the veterans that we serve. And so we provide surveys randomly to veterans, usually through the mail, and we ask that you complete those and send those back to us. I know that I have both Rachel Newby and Eric from the Veteran Experience Office on. Do one of you want to take a minute or two to talk about the importance of surveys and getting them back to us?
I'll jump on, Jeff. I don't see Rachel just yet. So, yes, sir. So, from a veteran experience officer standpoint, actually we really appreciate, when I say we, I mean the VA and our facility in a whole, the feedback, because it gives us opportunity to implement any type of process improvement opportunities, should those be appropriate. It also gives us opportunities to share any kudos or data boys that we received, compliments that we receive from veterans from the services that they have received here while at our facility. So as Jeff mentioned, if our veterans could take that time, should they receive a survey in the mail, just to take that time and fill out those surveys and then send those back to us. So like I said, that we could either implement a process improvement opportunity and/or give the appropriate kudos and recognition to our team here at the VA. Thanks, Jeff.
Yeah, thanks, Eric. And important to note that it's not just about making changes, but it's also about knowing what to sustain. And your feedback is important in making those decisions. So we do have about 5 minutes left. I'd like to give our audience the opportunity. I know if you're outside of the organization, you may not have access to the chat. So if you have a question, if you'd like to unmute your microphone and ask, now is the time to do it. The floor is open.
Contains lyrics that appear to reference ice cream. Does the VA have a walk-in clinic or urgent care clinic where if you need to see a doctor, but you don't need to go to the emergency room? Generally rely on a conservative fan base. Ryan may have more goodwill with fans who express.
So, ma'am, we do have a walk-in clinic for primary care each day. You'd come into building 29, let them know that you don't have an appointment, but you would like to access that same day service clinic. As far as urgent care, obviously our emergency department can cover an urgent care situation, but you also have access to the urgent care facilities out in the community. Do we have anybody online who might be able to explain that in a little more detail? Okay.
I can speak to some same-day access. We have same-day access appointments available in behavioral health as well. So if you have any behavioral health urgent needs, you can come on in and we can make sure you get seen that day, either by phone, in person, virtual, or remote. You can see a pharmacist, you can see a psychiatrist, you can see all professions that are available. There's a variety in behavioral health.
All right, thanks for adding that in, Nick. Loretta, can you see the chat that we have here associated with our meeting?
Yes, I can.
Okay, so I'm going to put a link to the webpage that gives some guidance on urgent care, some specific details. So long as it is an in-network urgent care facility, VA is going to cover the cost of that for enrolled veterans. So you do have access to urgent care. Even if you don't feel like coming to our emergency room, if it's not an emergency type of situation, you can feel free to use that urgent care facility that might be in close driving distance to your house. Thanks for the question.
Thank you.
Any other questions?
There was a question from Mr. Robert Emmert. When going to community pharmacy, any kind of referral needed?
Hey, yeah, thanks, Charity. We did get that answered as Pamela was finishing up her presentation. No referral is needed, but the veteran does need to bring their veteran health identification card to help demonstrate that they are enrolled for VA healthcare. Did I get that right, Pamela? Or Nick? Thanks.
Yep, that is correct.
Appreciate that. All right, any other questions? Okay, I want to thank all of our presenters today for sharing this valuable information with the veterans that we serve. I also want to thank everybody who took time to join us today. I know your time is valuable, and so thank you for taking the time to join us and learn more about the Dole VA, the great things that we do here, and the benefits that you have earned and deserve. This is being recorded. We will post it under the About Us tab on our public-facing website. You can see the link there. Mr. Kimball usually does that for us. For some unknown reason, I allowed him to go on vacation this week. So I will try to figure it out myself and get it posted as quickly as possible. But again, thank you for joining us. We'll get the recording posted as quickly as possible. Everybody enjoy the rest of your Wednesday.